Hi, I'm Professor Dr. Ashish Davalbhakta, and today we are in Aesthetics Med Spa and Advanced Aesthetics in Pune. Today's topic for this educational video is going to cover the facial aging and the non-surgical devices that are there that can help in retarding or delaying, or you could say even correcting facial aging. But before that, we need to understand that facial aging has three components. There is a loss of skin elasticity as you grow older. There is a volume loss, and because of these two components, gravity then starts pulling it all down. So there is a need when it comes to anti-aging treatments to not only correct the elasticity of the skin, the other is to put volume back, which we have covered in another video, and the third is to lift everything up. Today, the non-surgical options can help in the elasticity of the skin, and the skin needs to be treated separately, which is done mostly non-surgically, and then the structural improvement or putting things back into place is done surgically. So what are the things that are in the market or we can use for facial rejuvenation, for the improvement of the skin? The skin loses its elasticity. It also can sometimes get pigmented, and it develops lines and wrinkles where the skin folds repeatedly and the skin thins down in those areas. So you have to think about what are the pathologies that are happening and then try to correct that. The earliest that works and is very popular is the botulinum toxin, and you know that it's globally a standard treatment protocol and one of the earliest anti-aging treatments, which is quite established and very definitive in giving results, and that is injection of botulinum, which paralyzes the superficial muscles of the face, which are responsible for causing the lines and folds. And it is licensed for use mostly for the upper face, which is the forehead lines, the frown lines, and the crow's feet that you get around here. So if you inject botulinum toxin there in micro units, in small concentrations, then it paralyzes the muscles which are causing that animation, and it smoothens the skin and gives you a fairly rejuvenated appearance. And again, it's a minimally invasive kind of a procedure. Then comes refilling those areas which have deflated, and that's where the fillers, injectable fillers, come in. And again, these are minimally invasive procedures where you inject the filler, which helps in volumizing or lifting the tissues and putting the volume back in and help you look fairly youthful. So that's where the role of the fillers comes in. For skin improvement, there's nothing like improving your nutrition, because the skin glow or its health is actually a reflection of your circulation. And if your circulation has a very good oxygen carrying capacity, then it will show through the skin, because the superficial capillaries, they usually, if it has fairly good oxygenated blood, will look rosy and healthy. And that's where the role of optimizing your micronutrient levels come in. And that's what we do in our clinic. We check your levels, and then we can rectify all of them. We will have another video explaining all the tests that we advise and nutritional supplements that we give to help the skin to look healthy and glow. Not only it helps in making it look healthy and glow, but it also helps in reducing the pigmentation and the dark circles, and also helps in reducing your hair loss and various other things. So it would be a video worth watching when we come out with that. However, apart from that, there are creams which we prescribe for home care that you can use, and that helps in exfoliating the skin, and it helps in removing the dead skin cells, and helps in rejuvenating the skin by stimulating the regrowth of newer, younger, and fresher skin cells. And that's a very important component. If you have never looked after your skin, never had a facial, never had a exfoliation, the toning and the scrubs, sometimes there are scrubs that help in removing the dead skin cells and help the skin to look fresh. So all those things are kind of home care products, creams and other stuffs that help the skin to look better, and we do put you onto those It also helps in improving the elasticity and the tone of the skin. You do need sun protection fairly regularly, and I'm sure you've heard about sunscreens and regular use of sunscreens from so many other people. A step up would be the peels, and that's once you have done all this home care, then you can consider having glycolic peels or TCA peels or lactic acid peels, and there are various peels in the market which not only help in removing the dead skin cells, but also sometimes help in reducing the pigmentation or improving the hydration of the skin. So your physician may recommend peels, a session of peels, which you do say fortnightly or weekly, and you do it repeatedly, and then you find an improvement happening in the quality of the skin. The skin's turgor and elasticity depends on all these things, and some of you may find that when you pinch your under eye skin, actually it stays as a ridge. That's because the elasticity is so poor and the hydration of that skin or the tone is so poor that it doesn't snap back. And it's very important that that is all part of the anti-aging treatments that we do. So yeah, and then there are lasers, and there's fractional erbium lasers that we do, or even CO2 lasers, which are a little more powerful, and they help in causing micro-injury to the skin. That stimulates the repair process, and by the repair process comes the development of new collagen, and the new collagen is usually more elastic when it has all the ingredients that are required to form the new elastic collagen, and that again helps the skin. So you have to consult your physician, and they would help you and guide you in recommending the right treatment, which is for non-surgical rejuvenation. It's always better to start early, right in the 30s. Don't leave it too late. If you want to prevent or delay aging, start early. These treatments would delay the onset of the aging changes, and the need for therapeutic procedures would obviously be reduced. So I think this is a vast topic. I'm not likely to be able to cover all of it in one small session, but there will be more videos coming on this. Thank you for watching.